My name is Orla Cahalan and I am the Senior Inpatient Physiotherapist here at the Hermitage Medical Clinic. I'm going to take you through some of the physiotherapy interventions you should expect to receive after your joint replacement surgery here at the Hermitage. So why do you need physiotherapy after a joint replacement? The aims of physiotherapy are to regain your independence by ensuring that you can mobilise with your walking aids, to regain control, movement and strength around the operated joint, to ensure that you're able to complete steps or stairs as you need to, and in the longer term, to ensure that you can return to your normal activities. Depending on your surgeon, you may be required to mobilise on the day of surgery. If this occurs, you will be seen on the ward by a member of the physiotherapy team who will take you through your exercises and you will mobilise with your walking aid. If you have not been mobilised on day 0, that is the day of surgery, we will see you the next day, day 1. You will be seen by a member of the physiotherapy team to complete your exercises, and then you will mobilise with your walking aids. On day 1 after your surgery, you will typically be seen twice by physiotherapy, once in the morning and once in the afternoon. You may also complete steps or stairs today. If you have achieved all of your physiotherapy goals, you may be discharged from physiotherapy on day 1. If you have not achieved all of your goals, you will be seen again day 2. Again, we will review your exercises, practice your walking with your walking aids, and complete steps or stairs as required. Again, if you achieve your physiotherapy goals, you will be discharged from physiotherapy at this time. If you have not achieved those goals, you will continue to be seen on a daily basis until you do so. On discharge from physiotherapy, you will receive a physiotherapy transfer letter to be provided to your own physiotherapist in the community. It is your responsibility to organise your physiotherapy on discharge from hospital. So what are the physiotherapy discharge goals after a total knee replacement? You should be able to complete all the exercises in your home exercise programme. You should be able to mobilise independently with your walking aids. You should be able to complete steps or stairs as required. You should be able to achieve a straight leg raise, and you should be able to have 90 degrees of flexion at your knee joint. Once you have achieved all of these goals, you will be discharged from physiotherapy. So we're going to go through the exercises that you will be completing after your total knee replacement. The first batch of exercises are to be done lying up on the bed. And the first exercise we're going to get you to do is moving your ankles up and down. So this can be commenced as soon as you're able to after your surgery. This is going to help prevent clots forming in your calf. And from day 1 on, you will be doing it with the other exercises 3 or 4 times a day. The next exercise is for your thigh muscle. This is to encourage that muscle to kick in and to give you a nice stable leg when you're up and walking around. So you're going to push the back of the knee down into the bed, and you'll see the thigh muscle contract for a count of 1, 2, 3, 4, 5, and relax. And again, pushing down, contracting the muscle for 1, 2, 3, 4, 5 seconds. The third exercise is to help stretch the back of your knee. For this, we need a rolled up towel, which goes underneath the ankle. Okay. It's important that you never place anything behind the knee, such as a rolled up towel, after your surgery, even if it feels comfortable, as this could actually cause tightening of the hamstring muscle at the back of the leg. So under the ankle, the toes are going to come up to you and you're going to push your leg straight so that you feel a stretch coming down the back of the leg. Because this is a stretch, you hold this longer. This is going to be a 10-second hold. And then relax by dropping the toes. We're going to do a couple of those just to demonstrate. Toes up, pushing straight, holding for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Drop your toes and relax. One more of those. Toes up, push straight. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. We're going to remove the towel. The fourth exercise is the straight leg raise. So to do this, we want you to bend your unoperated leg up. This is going to protect your lower back while you're doing this exercise. It's very important that you engage your muscles before you attempt to complete this exercise in order to make it as easy as possible for you. So you're going to switch on your muscles, your thigh muscle, bring the toes up to you, and then you're going to lift the leg uniformly off the bed, holding for a couple of seconds and back down. Up again. Lovely. And back down. And let's do one more of those. Great. The final bed exercise is to get the knee bending. So for this, we're going to ask you to slide your heel up towards your bottom, up towards a 90-degree angle or a right angle, just about there, and back down. This is what we're going to be looking for before you go home, this 90 degrees or right angle, in order to ensure you have a well-functioning knee before you leave the hospital. So those are your bed exercises. You're to do 10 repetitions 3 or 4 times a day. And there are 2 seated exercises to also complete. These can be done sitting on a chair or seated on the edge of the bed. The first one is to move the operated leg in underneath, so bending your knee. Going as far as you can. When you feel you can go no further, the other leg can come in and help to get a little bit of extra movement, holding there for 3 to 5 seconds to get a stretch and releasing it out. And we'll just demonstrate that again. Bending the knee as far as you can and then get the other leg in. Perfect. Okay. The last exercise to be completed in sitting is to straighten the knee. So kicking the leg out as straight as you can, holding for 3 to 5 seconds and then slowly releasing it back down. And again, down, and one last one for us. All of these exercises are to be done 10 repetitions 3 or 4 times a day. We recommend that you start these exercises before coming in for your surgery, as this will greatly benefit you after the surgery. Your muscles will remember the exercises and you will find them easier to complete.